5 on your health. Our favorite dermatologist, Dr. Abby Waldman, is here in the newsroom. She can't even make it from the door to here without someone asking her a question because she is very knowledgeable. There's new research changing the way we think about acne, and it finds that the scars acne can leave behind may be more than just cosmetic. Very interesting. Most people think of acne as temporary. If you get a zit and it goes away. More than half of adults in this study had scarring from acne. I'm one of them. I'm 60. I still get acne all the time, and I have this. So I do look at the things that you say and what you can do. What about long-term scarring? What can we do?
Yeah, so I mean, 50% sounds like a lot, right? 50% of people that have acne get scarring, but that is what the data shows, and that is what we experience in the clinic. I think long-term, what dermatologists have known for a long time, if you intervene early, if you treat acne early, you have better outcomes and you scar less. And you want to take treatment seriously. And when you say that, you don't mean intervening by yourself and taking your hands and getting rid of your own pimples. That is not what I mean. I know. Yes, just remind everybody. With over-the-counter treatments or with a dermatologist. All right, so one of the biggest findings here, delaying treatment, that does increase the risk of scarring. So like you just said, get right to it quickly. How quickly do we see a doctor before do we try to do it ourselves? Do we go see you? So it depends on the severity. So if you have really deep-seated pimples like cysts, if you already have scarring, or if you have so many pimples and pustules and they're not responding to over-the-counter treatments, that is when you want to see a dermatologist, because it's the most associated with scarring, and again, treatment can really make a difference. You know what's interesting? It also, the scars link this to stress and depression. So in your patients, whatever you can share, how seriously should we be taking the emotional impact, and then what do we do about that? Yeah, so a lot of people think about acne being just skin deep, but it really has a big emotional toll. We long know that the scarring itself, the acne, can really affect your mental health. And so I think people should know that it's not about vanity, right? It's not just, oh, this is on my skin, it's just about vanity. That taking care of it really can help your entire well-being. It really can. And when you say see a dermatologist, we go into drugstores, we go to places, and you see on Instagram all of these things. How do you know what to do? And you're saying go see a dermatologist because you can guide us as to what products to get. They don't necessarily need to be a prescription, correct? Yeah, exactly. And in fact, a lot of times there are some great over-the-counter treatments for acne, especially if it's mild to moderate acne. So if you're just getting some pimples here and there, if you're getting whiteheads or blackheads, usually you don't need a dermatologist necessarily. Okay, that's good to know. So, but if you have more severe acne, that is when you really need to get something more than just over-the-counter. And I was just saying, you're such a great follow because you're so serious about skin cancer, and that really matters to you, and you're also showing people how to get rid of acne scars and all of those things. So the first time I've asked you this on TV, you could not even remember I know. what you were on social media. Can you remember now? Yes, on Instagram it's abby.waldmanmd. You can also follow me on YouTube and on TikTok. I know you could remember, it's just that I put you on the spot, and that's what happened, and now we all know.